This has been a bad week for County Mayor Carlos Jimenez. In the midst of a crisis, he issued a series of confusing and contradictory executive orders, and he tried to blame others for the confusion he created. One minute he's closing restaurants, then within hours he changes his mind. The same went for gyms. They're open, they're closed. It's been a profile in chaos. County Commissioner Xavier Suarez is one of the candidates hoping to replace him in the upcoming election. So I asked Suarez what he would be doing if he was running the county. Oh, and by the way, in case you don't know, his son Francis is the mayor of the city of Miami. Have a listen.
I would do it a lot more like the mayor of Miami than the mayor of Dade County. I assure you of that. I mean, there has to be some predictability. There has to be a lot of interaction also with the commission, which there hasn't been. Our committees have been basically defunct for about 3 or 4 months. We get calls from the mayor's chief of staff, never from the mayor himself. Maybe he doesn't like me a lot, I don't know. We have had clashes, but it's his chief of staff usually 2 minutes or 5 minutes before an executive order is signed. That's not the way to deal with legislative assembly that could theoretically supersede the mayor's decisions. And that's the way it's been pretty much for 4 months. So overall, let me not be overly critical of either the county or the city. I've been mostly in agreement with the city, not always in total agreement with the county mayor. But I do have to say that the idea that we have not done a good job collectively is not correct. I think we have done a good job. I was looking at the numbers in the last few days, for example, and we're beginning to discharge more patients than come in as far as hospitalizations for COVID-19. So I think we can continue on a path towards opening that will not cause great mortality or great harm for the particular group that we're dealing with now. Now, keep in mind that the tough decision is going to be, and I say the particular group we're dealing with now is about a quarter of the county population, about 700,000 people. And I wrote an article splitting it into the 4 quadrants, 700 in each quadrant. This particular quadrant that is now being highly contagious and highly infected is young people and the service industry that particularly caters to young and working people. And it is not a high mortality situation. It is a high contagion situation. And there's probably no way to avoid it. It's almost like in that particular quadrant. I know it's a little bit technical.
Yeah, I don't want this to be just a 10-minute soliloquy by you. So I want to ask you some very specific questions here.
Yes.
You know, did Miami-Dade County reopen too soon? Yes or no?
I don't think so. I don't think so. I think there was a little bit of a lack of the kinds of measures that I would have put in place for restaurants, hotels, and other shops and other retail facilities, and you know, shopping centers, grocery stores, etc., to make sure that every single person that walks in doesn't have a temperature and that every employee doesn't have the virus. Protective equipment is great, but you've got to make sure that you're not having people-to-people contact of folks that already have the virus. And we didn't do a good job enough on that. But yes, we reopened at the right time.
I'm surprised to hear you say that the county reopened properly, given the explosion in the number of cases, the fact that we are seeing, you know, a rise in hospitalizations across the county. ICU units are at their capacity at a number of facilities. Doesn't that suggest that there was a problem, and isn't reopening part of that problem?
By my count, we have maintained 20% capacity in public health facilities, actually oscillating from 19.8 to 23% in the last couple of days. Our capacity has improved. And again, we're only talking about a 1/4 of the population that is affected. We're still protecting the elderly, many of them by themselves. In other words, just knowing that they can get this. And anyone that has a respiratory illness, anyone that has any kind of a heart condition, anyone that has diabetes, you know, those folks are protecting themselves. The young and the students and their teachers, which is another quarter of the population, is a tough question. In other words, that could be an interesting subsection of the population. And I'm glad I'm not the superintendent that has to make those decisions. I think, by the way, the direction he's headed in is a very wise one, which doesn't seek to reestablish full classrooms. And that could be very problematic. And to have very tight controls of protective equipment and very tight controls of any of the employees on a daily basis, and weekly testing and daily basis taking temperatures. That, I think, can be done for that quarter of the population. A quarter of the population, which is you and me, we're doing our professional activities from home. And so that also is a good, but the folks in the service industry and the young people, and not so young in my case, but healthy, that want to go to restaurants, that want to go to hotels, that want to revive our retail industries, we're going to have some contagion. Thank God the mortality rate is very low, and that's what we're going to get through. But we've got to restart the economy. We can't let it go the way it was going.
County Mayor Carlos Gimenez has issued a series of executive orders, many of them contradictory. Sometimes he issues an order saying there will be no restaurants are going to close, then suddenly outdoor restaurants are going to be open. Then he goes at a press conference and says we won't be able to reopen them until we're at 5%. Then he has to issue a clarification. 10%. Is the mayor of Miami-Dade County doing a bad job of communicating to the public what's going on here?
You're questioning me on a day where he's had a couple of really bad days, and they're not the only two bad days that he had. He criticized the mayor of Miami early on when Francis canceled both Ultra and the Calle Ocho. That would have been approximately 400,000 people from over 100 countries. That was a great decision made by Francis. He criticized later when Francis asked the president to do something about folks coming into MIA. Then he was very sort of back and forth. He imposed curfews at times without any, pre-meditation, without any consultation of anyone. And now I think we're in a curfew, 10 p.m. curfew, and for no good reason. I don't understand that. Yeah, the back and forth in the last couple of days, I think someone in the media said something about mayoral, what's the term? Moonwalk, mayoral moonwalk. And this is not good. And by the way, not consulting the cities, particularly the major city whose mayor has done a great job throughout, is ridiculous. It's almost like something that a person would do who has a kind of a thirst for power. That's a strong statement by me. I haven't made one up to now like that for 4 months, even though I haven't been consulted particularly by Mayor Gimenez, and I wasn't consulted in either the initial move or the counter move. So yeah, you're right. Lately, things have been kind of sliding out of hand for Mayor Gimenez.
Let's talk about the broader race for mayor that you're in. Obviously, we're just a few weeks from the election. How difficult is it to campaign under this environment? And what are the issues that you're trying to get across? Obviously, everyone is preoccupied with the pandemic, but what are the issues that you're hoping will break through for you?
Everything is different. My first big problem was that all these interviews are Zoom conferences or Skype, and I've had every technical difficulty imaginable. Plus, not being able to meet up with people and not being able to be with your opponents in one forum where people can see you is a problem because, it just isn't the same. The other issue is how many folks are actually going to show up at the polls as opposed to using absentee ballots. And if we rely totally, as it seems like we're heading in that direction, voting by mail, that is a little bit of a skewed electorate. And we're having to deal with that. I mean, we all have internal strategies and statisticians and experts, so-called experts helping us. It's not traditional politicking. There's not a lot of face-to-face. In some of my books, I've written about face-to-face democracy, kind of direct democracy. you know, this is kind of far away from that. It's very electronic, a little bit detached, confusing. And I think, frankly, the voters are more looking at November than August. And that's a scary proposition. If people don't participate in August, we're not going to get a fair sample of folks in this county.
Well, again, what's the major issue for you that you are trying to communicate with voters, trying to get them to break through on the pandemic?
Before the coronavirus, it was clearly transportation, and it still kind of is. And we have an opportunity now. We have an asset that came out of a liability. We've lost so much in revenues from the coronavirus, and we've slowed down, or we've reduced rather, the number of folks that are expected to use automobiles in the future, probably by 20% from people staying and working out of their homes. And then if we do free public transit, which I have proposed, I think that's another 20%. So we're going to have 60% of the traffic we used to have, and that bodes well for us. It's going to cost a little bit of money. The lost revenues from free public transit, which I have proposed, somewhere between $40 and $100 million.
The next mayor of Miami-Dade County is likely to face some severe economic realities. You know, loss of sales tax revenue. The county budget is going to take a major hit. You know, if you're talking about providing more free transportation, providing more affordable housing, you know, I think the reality is that you're probably going to have to, or whoever the next mayor is, going to have to do some serious cutting to the county to make up for all the lost revenue because of these businesses being shut down, and many of them going out of business. How do you address that?
And I proposed that serious cutting back to 2011 when I was elected, and Chairman Martinez asked me to do a task force report. I thought I was going to get a lot of help. I ended up doing pretty much by myself. And I proposed at the time savings of $400 million, which was 10% of the entire operating budget of the county. Now it would be more like 8%. But serious cuts have to be made. I mean, we've been asked to approve $88 million in furniture, new furniture, $100 million in new automobiles. We have 7,000 automobiles. We haven't reduced the fleet of automobiles. We have 4,000 people making over $100,000 in the county. One department, the IT department, that hasn't fared too well in all of this, by the way, because these Zoom meetings haven't worked out real well, has, you know, $211 million budget, a department that didn't used to exist 30 or 40 years ago. We have a lot of fat in the county, and I'll be cutting a lot of it, and people are going to be very surprised.
We'll be right back.